Now today's topic is speech and swallowing. Okay? How many of you have experienced some speech problems? Yeah? Why do you think that happens?
It's part of Parkinson's.
It's part of the Parkinson's disease, all right? It's part of the Parkinson's disease. We're going to talk about speech first, all right? What happens is the muscles in here, and remember, Parkinson's disease affects all the muscles, right? This is the muscles in your body. They're affected by it. Every muscle in the body, right? What do you think? What is the tongue?
Muscle.
What do you use to swallow? What do you use to speak? What do you use to smile? Right? These are all muscles, all right? So as the disease continues along the way, you might be dealing with speech problems. I always recommend from the minute of diagnosis, you get into some type of a speech therapy. That's why we're offering up Mary Spermelli once a week here on Wednesday, right? Because it's a lot better for you to keep this strong and functioning, because what is more important than communication? Huh? What is more important than the ability to speak with someone, and why is communication so important?
You're going to need help at some point, and you need to be able to communicate.
Yeah, you need to be able to communicate from all different reasons and from all different viewpoints, all right? You need to communicate your what? Your feelings, right? Your feelings. And if you don't have the ability to articulate and to get the words out, what happens to those feelings? What happens to your ability to talk to your loved one and your friends about what you're feeling and what your needs are living with Parkinson's disease? What happens, and why is that so important?
You can't communicate, you can't fully express yourself.
Yeah.
Or you're misunderstood.
Or you're misunderstood. Your ability to get the words out to your loved one, to the people in your life, is critical for you to get your feelings up and out and inside somebody else. What does the word communication mean? Now, I'm not saying the word talk. You know, I can talk. I talk for a living. You know, yakety, yakety, yak. I talk to total strangers. I talk to dogs on the street. I talk to anybody. Okay? I talked to a duck this morning that wouldn't get out of my way at 10 minutes to 7. I was like, I refuse to hit this duck. You know, I'm done. You know, just move, duck. You know, I'm out the window, duck. It's me. Get out of the way, right? Okay, I can talk, but the ability to communicate is your ability to get what's inside of you into inside of the person that you're talking to. Whether it's your care partner. I'm working real hard at using that word care partner, because you told me last week you wanted me to do it. They're trying to change me, Sandra. Sandra and I trained nursing school in Joni Bravo to back with the dinosaurs, you know. We've been doing it for decades, right? Okay, so it's patient, caregiver, but I'm trying to change now. So now it's the person with Parkinson's and it's the care partner. Okay, what's your need to keep an open line of communication? Your feelings into your loved one is critical, because what is more important than the communication, loving relationship between you and your care partner, right? And your ability to talk about your needs and your feelings and your concerns, as well as to say the good stuff. My Parkinson patients, you know, I want the good stuff coming out of your mouth as well. Like what?
Thank you.
Thank you. Don't let anybody do anything for you that I don't hear the words thank you. You got me? Thank you. What else do I want to hear?
Please.
Please. Oh, no, no. Please and thank is very nice. What else do I want to hear?
Appreciate it.
I thank you. I appreciate you. My life is better because of you. You people with Parkinson's disease, you know, you don't have a ticket to be lazy. You don't have a ticket to get on the recliner and just say, oh, do for me, babe, I'm done, all right? And even if you can't do some of the things that you used to do before, you can still have the ability to motivate and to encourage the person that's walking hand in hand with you every minute of your life. Am I right?
Right.
So you've got to keep that voice going so that you can say, thank you, I love you, I appreciate you, my life is better because you are in it. And how many of you are doing it? And I can tell if you're lying to me. How many of you are doing it? If you're not doing it, you will start today. All right? Or no more cookies. No more brownies. All right? The least that you can do for your care partner is to keep them up and to keep them motivated and to keep them feeling appreciated, because guess what, my Parkinsonians? The role of the caregiver is the worst job in anywhere. The hours are long, the pay is lousy, there's no perks, there's no backup band, there's no nothing. Am I right? No volunteers. You got nobody standing behind you saying, "Oh, let me give you a week off, and I'm going to do your job." All right. So your ability to speak is huge. If you are not in Mary Spinelli's voice aerobics class, where do I want you?
In her class.
Why do I want you there? Because she's good. Okay, yeah, I think she's great. She's a wonderful lady as well.
Maintain what you have.
You maintain, you hold on what you have, because with this disease, your speech is going to give up. It's going to go down and go down and go down and go down. And as clinicians, and what we offer here at Parkinson Place is, you're here coming into us, we're going to keep you here. All right? Guess what else we have starting tomorrow for you? Very excited. How many of you love to sing? Other than Chuck, he's going to sing a solo for our guests today. All right, we have Phyllis Lowwood is coming back. You know Phyllis? Phyllis has returned from Aspen. She was also in Kenya visiting her grandchild. I go to Orlando to see my grandchildren, and Larry goes up the coast a little bit, but she goes to Kenya to see her grandchild. But she's starting now with the chorus every Wednesday. So here at Parkinson Place, you have 2 hours a week, Voice Wednesday. All right. This isn't get together and sing Yankee Doodle. All right. This is deep breathing. This is articulation. This is camaraderie. This is voice and breathing therapy for enhanced speech. All right. So I want you to book off on your calendar Wednesday afternoon to keep your speech going on. All right. Keep talking in the house. How many of you have us? I like to see you holding hands. This is why I like my perch up here, because I can tell when you're getting along and when you're not doing so good. I see you giving each other a whack or a dirty look, you know? But then I also see you loving on each other, which is my favorite thing to do, so that's a good thing. Okay, so get involved with this. Mary will also help you with in-home exercises. You know, once a week isn't enough. A lot of things you're doing here with us, you know, 5 days a week. But when you're at home doing nothing, you know, you can do some of these exercises as well. All right, do it. This is your empowerment. This is you saying to me, Marilyn, I know that my voice is going to decline. I know I'm going to whisper. All right, so I want you to do everything that you can to speak up. You have my approval to yell at me. Only you. Okay? All right. So do this, all right? How many of you are talking about your feelings to your loved ones? All right? Okay. Set a time during the course of the day to talk to each other. You know, what is the greatest enemy of any relationship? Silence. Okay? Silence. We need to talk to each other. You need to share your feelings. You know, you need to work together. What is the nonverbal communication? What is the greatest form of communication? This is a law according to Marilyn. What are they doing right over here, table number 2? Touch. Right? Touch is huge. Why? It's so easy. You don't have to come up. The other thing too with communication, it takes a lot of energy to communicate with somebody. You got to think about your words. You got to think about what you want to say. You want to make sure that it comes out nicely. You want to be sure that it's perceived by the person that you're talking to in the right way. All right? If you're not going to say anything nice, or courteous or respectful, do what?
Nothing.
Huh? What'd you say?
Sit by me.
Sit by me.
No, that was some socialite that said that years ago.
Yeah, just sit next to me. You know what? Steel magnolias, right? Isn't it fun? And it's so easy, you know, just to purge. But always remember, friends, you can't unring the bell. And you folks, you Parkinsonians and your care partners, your goal is to have a positive relationship. Am I right? You got enough going on. So you want to work at that real positive relationship. So if you say something cruel or hateful, okay, maybe you're tired, maybe you're stressed. It's the one thing that I hear when I counsel with people in that back room over here. I yelled at him, and I'm like, you might have had a real good reason. You were tired, you were upset, but what do? I'm sorry, all right? But be very, very careful about what comes out of your mouth, because you care partners, your goal is to bring them up. The esteem of a Parkinsonian, their esteem is down here, right? And your goal is, attaboy, you're doing great, I'm proud of you, you look great, oh, look what you did today. Because the higher level you keep your loved one, guess what? The better your life is going to be. You agree with me? Okay, so work it. And a lot of it is with communication. Okay? All right. Now, swallowing is a big problem. It's a huge problem with Parkinson's disease. It's the most dangerous symptom you've got. Did you know that?
No.
It's the #1 problem you have. The highest risk symptom that you have is swallowing. All right? What do you use to swallow? This is all muscle, right? And I'm here to tell you, you all know, you know, you got 2 little pipes going down here. One goes where? To the lungs, all right? That's a sterile cavity. And the other one goes through your esophagus and into your stomach, which is up here, okay? Well, lots of times you can have a swallowing problem, and you don't even know it because it can be going down the wrong pipe, right? With no symptoms at all. Lots of times you say, oh, I'm choking, it went down the wrong pipe, you know, okay? So you're assuming I'm choking on food. But you can be swallowing with your food going right into your lung and not even know it. What happens when this happens?
Aspiration pneumonia.
Aspiration pneumonia, okay? This is not good. High infection, all right? So you want to be very, very, very careful of this. How do you overcome swallowing problems? And this is big for you Parkinsonians, so I want you to pay attention to this. So if all of a sudden you say, you know what, I was doing well with, what do we call, like a regular diet, all right? And then all of a sudden I'm having a little bit more problem, or I'm choking, or I'm having more trouble. The other thing too is you have trouble with your chewing. What do you use to chew? Your jaws and the muscles in here that's going up and down, all right? Okay, 1/3 of the digestion happens where?
Mouth.
In your mouth, all right? I want you to take your time. I want you to chew your food. I want you to choose your foods wisely. But all of a sudden, if you're having trouble with your chewing and your swallowing, and you obviously know it, what do I want you to do?
Stop.
Stop?
Stop
Hello,
chewing
Pete.
and swallowing and drink water.
What do I want you to do if you're noticing more chewing and swallowing problems?
Has your doctor done?
Hello? All right? After your loved one and the staff at Parkinson Place, your doctor is your next best friend. Right?
Right.
All right? So if you're noticing these problems, you pick up the phone and you call, because I'd rather you be safe than sorry. All right, you all know we have Dr. Madden back here. How many of you seen Dr. Madden? Extraordinary. I had a compliment from a member yesterday when I was getting a testimonial, and he said by far and away he's the finest neurologist that they have found to date. Board certified neurologist. He's here from Boston. He treats patients here at Parkinson Place all day Monday and all day, Thursday, by appointment only. All right, so if you're interested in seeing him, I want you to do that. We also have Dr. Juan with us. You all know Dr. Juan Sanchez Ramos. Very proud. He runs the USF Parkinson Clinic here at Parkinson Place. And you can see Dr. Juan on Wednesday afternoons by appointment only. Now, Dr. Juan sees the more complex cases. If you're doing great, okay, if you're doing great with your maintenance neurologist, you don't need to see Dr. Juan. But if you're seeing serious changes or some serious concerns, or if you think you can be doing better, he's the best that we have in this area, and we'll get you an appointment to see him for an assessment. He'll work with your neurologist to make sure everything is as it should be. You all know how important it is that your drugs are on. Okay, how many of you are what we call drug compliant? Huh? Are you awake out there? Am I the only one working up here? Huh? I haven't had my cookie yet, and I'm awake. Your medications are critical to you. All right? This is a disease that affects every muscle in your body. This is a disease that affects you physically. What's it doing to you physically? Okay. I'll say that a little louder. My boss is sitting there. I don't think I ought to repeat that.
Knocks the hell out of you.
Huh? It knocks the hell out of you. Got it?
Deteriorates your muscles.
It tries to make you weak. It takes away your muscles. What are you doing physically?
Exercise.
Go to the gym, exercise, come to Parkinson Place. You know, we have 5 different exercise programs here. Who can name them? You better be able to name them.
I can name them.
Name them, Pete.
We got Tai Chi, we have voice, we have dance, we have yoga, we have exercise in the chair, and we have the one with Mary.
Mary Massey is Ageless Grace. How many of you tried Ageless
You just
Grace?
got big.
Guess what? It's the hardest class we got going on in here because you don't stop for 1 hour. You're sitting in a chair, so I thought it was an easy class for you.
Oh, no.
Right? It's the hardest class we got going. It's non-stop. And you need to know Mary Massey, okay? So I want you to take advantage of every single one of the programs that we've got going on here, because guess what? They're what we call evidence-based. I'm not making them up. You know, that agenda, that calendar, everything that we're offering you through the Parkinson Research Foundation is evidence-based. There's data behind. They're telling us that if you do it, you're going to feel better. You're going to do better. You're going to improve. All right? So it's here. All you have to do is get up and come in and do it. I always say if you want to stay alive, stay out of the recliner. Right?
Right.
All right? So that's a very, very good point. It's going to help you with your physical strength, with your balance, with your endurance. And guess what it does? It's a great for your stress and for your overall well-being. You're going to sleep better. You're going to eat better, right? How many of you are doing a nice exercise? You're doing your nice walks now. It's getting cooler, right? You can walk in the morning now because it's lighter in the morning, cooler in the morning, okay? You got to get up. You got to move. The 2 things that you can do to enhance your health and wellness, there's 2 things that you can do, and you control both of them. What are they?
Attitude.
No. For once, attitude is not the right answer.
Get out of bed in the morning.
No. You control what you put in your mouth, and you control how much you move. Who owns that?
We have to.
All right. Who owns any of this? Yeah. We all have to take ownership in our own health and in our own wellness. All right. We all have a choice of how we think. Number 1 key to facing any challenge in life, and I don't care what it is what?
Attitude.
What kind of attitude?
Positive.
Positive attitude. You can meet and greet any challenge in life with the positive attitude, because guess what? The body will follow the mind. All right? I've been in healthcare. Shall I lie? Couple years. And I know that a human being with a positive attitude, with a sense of empowerment, with a sense of joy, with a sense of gratitude for their life, that want to see the good and not the bad, their body will follow suit. I've seen it in nursing for 100 years, right? Any of us in healthcare, we know it, right? People that feel, okay, I'm happy for the day, I accept who I am, I'm going to give it my best shot. They're going to do extremely well. And then you can have somebody that's the doom and gloom, you know, the sourpuss, all right? Nothing wrong with them. But they have aches and they have pains and they're not motivated and they have no quality of life, all right? What does quality of life mean to you? You hear it all day long. We all strive to give everybody, to give ourselves quality of life. What is it? What is it to you?
Being happy.
Being happy is part of it.
Enjoying what you're doing.
Enjoying what you're doing. How many of you are happy? You have a choice. You know, do you want to be happy? Do you want to be sad? Do you want this disease to run you over? Because it will. I don't give a whole lot of credit. I give the credit to you. I give the power to you. But this is a tough disease. It's one of the toughest ones out there because it affects you physically, mentally, emotionally, and socially. If you want to see the future, if you want to know the future, you create it today.
That's right.
All right? And that is your empowerment. All right? Today really matters because why? I'm feeling awful philosophical today. What's wrong with me? I don't know. I'm coming up with all these one-liners. What's wrong? Something.
Have another cookie.
All right. Today really matters because it's the foundation for tomorrow. Right? A lot of people think, I'll do it tomorrow, I'll change tomorrow, I'll worry about it. You're going to get one pass at this day. So you got to make it today your very, very best because it's another building block to who you are tomorrow. And what happens today, what you learn today, what you experience today, how you feel today, what you do for yourself today is going to change you so tomorrow you can be better. I was thinking the other day, I thought to myself that the Mary that exists today will not exist tomorrow. Why? Because of today. And my life events and my experiences and my encounters today. All right? How do you stay positive with this disease? How does this disease make you feel? One word. Just tell me out one word.
Depressed.
Depressed? Come on, think. Oh, come on. Depressed?
Frustrating.
Frustrated?
Tired.
Tired? Challenged?
That's a good one.
Challenged is huge. Why are you challenged? What's challenging you, Tim?
It gives me the tools I need to go forward and try to accomplish what I can, and accept what I can. Try to help not only you, but
What does the word challenge mean? Never thought about this. It's a good point. He's challenged by it. The more he's challenged, right, the more he pushes himself to try harder and to do better. It's a very good trait because you'll survive this, right? I'm guilty of it too. The harder it gets for me, or the more of a challenge I have, the harder I push at it, you know, to overcome it and to get past it and to learn from it and grow from it and to build from it. So it's good to have that stamina personality to do it. But you're challenged by it every minute of every single day. All right? From an emotional standpoint, guess what? It's not going away. You know, it's not like getting a total hip and in 6 weeks you're going to be dancing jig. Or it's not like, you know, getting a bypass and then when you get through it, you're better than ever. You're with this. This is with you. It's you and your Parkinson's disease today, tomorrow, and forever. How's that make you feel?
Great.
Crummy? So what's the key? The key is to build a relationship with the disease and say, I got it, it's here, I got to make the best of it, I'm going to stay positive, I'm going to live my life, and I'm going to move forward.
Yogi Berra said it best, the future's not what it used to be.
Okay, the future's not what it used to be. That's a good one. Thanks. Yeah, I forgot about Yogi. You have Parkinson's, Parkinson's doesn't have you, right? That is the attitude, that is the disposition, that is the habit, that is the lifestyle that I want you living every minute of every day. Because it's going to be a challenging minute for so many of you. Yeah.
Do everything you can to make yourself as good as you can where it doesn't get the best of you.
Right. Do everything you can to be the best that you can. This is your empowerment. All right? One thing with living with this disease is you got to face it. You know, the thing about life is you got to stand up and you got to face it. All right? How do you face life? You face life on your emotional belly. All right? You face life standing up strong and tall and empowered and proud and motivated. And you stand up where? Only in your mind. You know, there's people in this world that will never stand again. They'll never stand again. All right, I told you about that. I used to do MS, and I remember this one lady, I think of her so many times. She had this ritual, this little exercise every day, and she would stand for 5 minutes a day and hug her husband. It was a ritual. And then for the rest of her day, she was in a chair. Okay? But in her mind, she was strong and empowered and living just like somebody that was running down the street. Okay? So you live here. Your attitude, your disposition, your patient caregiver etiquette is here. The most important thing I think that PRF and I try to do for you is educate, because knowledge is power. So you'll find with anything that we do, any of our programs, our conferences, our symposiums, our lunch and learns, my Parkinson Powers, my caregiver groups, it's education. You have to know this disease inside and out. I want you to know your symptoms. I want you to understand dementia. I want you to understand how to eat and what to do with this and that and the other. That is your empowerment, to know it, to understand it. That's number one. And if you have a knowledge of it, you see it, you understand it, you can have a relationship with it, and you will deal with it. You will deal with it. Because I'm here to tell you, everything that you need to meet and greet Parkinson's disease, everything that you need to meet and greet any challenge in your life, any difficulty, any hardship, it's inside of you. Do you know that?
Absolutely. Yes.
It's the truth, and I want you to understand. Most of the time, your courage is hiding out in your toes. You notice that? Oh, it could be further away. Pull it up and use it. You know, you're smart, you're brave, you're courageous. You have the ability to stay in control. And what good is a life that you can control the outcome of? And you control whether you sit or whether you stand. You control whether you're happy or whether you're sad. You control what you put in your mouth. All right? So where is the empowerment? I mean, I can sit here all day long and talk you into next Tuesday, and you all know I can do it. If I just keep feeding them, I can just keep right on talking. I've done 8-hour conferences and just kept on talking, right? All right? I can talk to you and talk to you and talk to you, but if I can't motivate you to do it, I've failed.
That's right. But you haven't failed, Marilyn, we have. Because you've given us the knowledge. But if we don't take the knowledge that you give us and put it into use, action.
Yeah. Apply it. Come on, Toya. Yeah, you have to apply. All I'm going to do is give you advice. And then I'm going to keep an eye on you. You know, I'm strict. I do home checks. You know, if I see you falling off, you know, I might show up at your front door. Where are you? Please come in. All right? I want you to be happy. You know, it takes more than just a pulse to be alive. Am I right? Right. And this disease is going to try to knock you down. It's going to try to rattle your cage. Okay? What makes you extraordinary and special, what makes other people love you and respect you and honor you, this disease cannot touch. No disease out there can. You got that? So for my care partners, it's the third time today I said the word care partners. I'm so proud of Marilyn. Okay? Your care partner always, when you look at your loved one, all right, don't see the symptoms, don't see the changes. They're in there. They're in there. It's the same beautiful human being that you fell in love with. They're there. They look a little different. They might talk a little different. They might be able to do things a little bit different. But it's your same precious loved one. So this disease is not going to touch you or change you in any way. Are we clear?
Yes.
With that, look in the mirror and love what you see.
Put yourself in there.
And my care partners, if you want to be a kind, loving, patient, committed care partner, and you're starting to stress, depressed, and out of control, what have I taught you to do?
Run away.
Say it, Phil.
Put yourself in their place.
Put yourself in their place. Get behind the eyes of your loved one. All right? The ability to empathize, to understand. If you are, you know, what we call stressed, depressed, and out of control, and a lot of caregivers are, a lot of care partners are, you go behind their eyes and say, what are they feeling? What is it like? Okay? And it'll bring you right into the zone where I want you to be, where you can be loving and patient and kind. All right? The role of a care partner is to make a positive contribution in the life of your loved one. You're not there to make it worse, are you?
No.
I hope not.
You hope not? That's encouraging. Okay? So the thing is, I want you to work together. I want you to play the positive note. I want you to realize that everything that you need to meet and greet this disease is inside of you. All right? I want you to reach out. You know, we're always here. Monday through Friday, we're here. You know, the staff is terrific. There's Larry over there. Larry's here every day with the rest of us. So if you have needs, if you have concerns, if you have questions, you come here. All right? And one of us will help you out, get you to the right people in town to help you as well.